The next question is from Susie. It says, can Justin explain lower gender reassignment surgery? How does a man fully transition into a woman and vice versa? So let's do the man first. So lower gender reassignment for a man. How would that work?
Lower gender reassignment?
Yeah.
Well, hormones, but that's not necessarily going to get rid of your penis or your
right,
testes.
exactly. But that's usually how it starts. Is starting with.
I've had a lot of girlfriends actually who have what's called an orchiectomy. So an orchiectomy, you can have your testes removed, but you can actually still keep your penis. So I have a lot of trannies that enjoy being the active role. In gay lingo, we call it being a top. And so they wanted to keep their penis, but they get rid of their testes. But that also takes out a lot of their test production, so they don't have to take quite as much estrogen. So you can do a partial trans as a male to female in that respect and still retain your penis, although your test level goes way down, but that will save you on your hormones and not having to do injections quite so often. And then the obvious surgery where they actually turn a penis into a vagina honestly depends on the length of the penis, which is interesting. The longer the penis is, the deeper the vagina that can be made. And so they actually take that tissue and majority of it, without going into too much detail, it's inverted. And then there's a series of activities that have to be done afterwards to be able to keep that channel open. And everything's connected so that it works just like a regular female's anatomy, and they form, the lips and all of this with grafting and tools like that. So typically in the past it would take, 3 or 4 surgeries. I mean, now you see some of these doctors actually performing a majority of it in 1, possibly 2. So it's an interesting, very cool procedure to sort of see go on. I mean, the female to male is a bit more difficult, and they have to take grafts, but they have done some amazing things where I've even seen flaccid gains on penis. I don't want to say penis gains. I guess you want to talk about it, and actually constructing penises where at flaccid they're 9-10 inches. I've seen some of them actually, and they'll do grafts on like the inner thigh or different portions of the body where they harvest the tissue. But then there still has to be an implant that's put in at a later date after that tissue all heals, and there's also more grafting that they have to do in order to make the illusion of the gland for the head.
Right. Thomas has had that surgery, and he came on and talked about that as well. And it's a lot. It's a lot of surgery. Yeah. It's a big commitment. I think it's a huge commitment when they're going to do something like that.